thing that we've noticed, I mean, technology isn't going to be able to, take over all of the front end processes. I mean, we have a lot of questions, legalities and, requirements, through CMS and the federal government that we still have to kind of connect with those patients. So one of the things that's really worked for us is we've created, instead of waiting for these patients to come on site for their service and having them wait in line and asking all their questions while, clinical teams are waiting for them to come back for their procedure, we've created a centralized pre-registration department that is completely remote. And they are just calling patients, 5 to 10 days prior to their service and doing all of that pre-registration, full registration, prior to the patient coming in, which they can also help, with wayfinding, reminding of, times to be there. That's the time we spend with them to go over their financial responsibility. If they have any questions as to why they owe this, we can have, those questions and discussions if they happen to be out of network and they were scheduled. So, although that technology is coming, we still have that pre-registration team who's really kind of going through all those required fields, but getting it done ahead of time, pre-service. And then we also then send them a self-registration link, which they can go in, review everything we've input. So, they're still kind of making sure we didn't misconstrue their address, the phone number didn't change, they still have an eye on it. Review any documents that we sent them, sign their consent form. If they didn't pay during the pre-registration phone call, they can pay during that portal. So, it's kind of, we've integrated the technology still with people, to make sure that we are accurate and we're still meeting all of the regulations and guidelines that we need to. But then when they arrive for their service, it's seamless. It's basically, I'm here for my appointment and the only thing they have to worry about is whatever they're there for today. So it's really helped us. We've got a lot of accuracy doing both people and technology. So I think the integration has been a great patient experience that we've implemented at ProMedica.